What's up, guys? Hey, Jared Beckstrand here, Doctor of Physical Therapy, ConanTitan.com, answering your questions today all about diastasis recti. We're going to talk specifically about which exercises to avoid if you have this condition and which exercises are going to be the best for it in order to help you guys heal up, in order to help minimize that appearance. So let's get to it right now. Diastasis recti is a common condition that I treat in my physical therapy clinic. I'd say the most common population that I see it in is pregnant and recently postpartum women. However, I have treated a few men with this condition. Male or female, the same rules are going to apply in this video. Now, to give you the anatomy lesson behind the condition, you've got four muscles that make up your abdominal wall. The most anterior and the most superficial, meaning the one that's right in the front, is going to be that six-pack muscle right down the front. It's called your rectus abdominis. It originates right on your lowest ribs and it connects right into the top of your pelvis. It's the muscle that comes again right down the front, and it's separated into two what we would call muscle bellies. They're joined in the middle by some connective tissue, which again in pregnant and mostly in pregnant conditions, excessive body fat, excessive belly fat, anything that puts undue stress on your abdominal wall causes that ligament or that sheath of connective tissue to stretch out and can, in really severe cases, actually tear. And so that is what we would refer to as the diastasis recti condition, is basically a separation of that anterior abdominal muscle, that rectus abdominis muscle. Now, fortunately, there's a lot that the right muscle activation, the right exercises performed in the right way can do to mitigate the effects and the appearance of this DR condition. Your deepest abdominal muscle is called your transverse abdominis, or your TA. It originates right on your lower back, it wraps around to the front, and actually connects right underneath the rectus abdominis into that same, or some of those fibers actually go right into that same ligament that gets stretched out. Now, when we contract that transverse abdominis muscle, that's the suck it in muscle, for lack of a better word. If I hang out relaxed like this, and then I can pull that, I hope you guys can see that, might not be very easy to see. I can activate that transverse abdominis to actually suck everything in and hold it tight. Now that's the muscle that we want to activate when we're trying to heal up the DR condition. We want to try to avoid contracting that rectus while promoting contractions in that transverse abdominis muscle. That's going to be the best for it. So basically activating the muscle right here in front is going to be a no-no. We're putting too much stress on it while it's trying to heal, while it's trying to come together. Activating the muscles that come and wrap around the side is going to be a bonus. That's going to be the one that we're after. And so let's show you some great exercises to activate the TA while avoiding that contraction right in the front, right in the rectus abdominis. Alright, so while I know a thing or two about exercise prescription, I brought in the expert in my family as far as actually performing some of these diastasis recti exercises.
Can I say?
Enough.
Had 4 kids.
So this is my wife Camille. She's had 4 children. After each one, we kind of had the diastasis problem that we rehabbed every time. If there's anyone that's an expert with these, it's this lady right here.
It's me.
And so I brought her on to demonstrate some of these don'ts and do exercises for you guys. And so she's going to go ahead and lay down on her back. The first no-no that we want to avoid is going to be a crunch, and she'll show us how to do that. She's got her hands behind her head. She's going to lift her shoulder blades up off of the ground. Basically what we're doing here is totally activating, you're good there.
You can see it.
Is totally activating that rectus abdominis muscle, that muscle that goes from the bottom of the rib cage to the top of the pelvis. Again, that's that six-pack muscle that's been separated. We want to try to avoid actively contracting that against a resistance. And so instead of doing the abdominal crunches, what Camille's going to do is an abdominal bracing or an abdominal hollowing, or sometimes it's even called a stomach vacuum. What we want to do is activate that deepest abdominal layer, that transverse abdominis. And so in order to do that, what she's first going to do is get her pelvis into a neutral position. And so I don't want to be able to slide my hands underneath her back. Basically what she's going to do is rock her hips backwards. Looks just like that. So now her back is nice and flat. And then again, we're going to work on activating that deepest abdominal layer, that transverse abdominis. That's the suck it in muscle. Now, most people, in order to activate this, they think that they're activating it simply by taking a deep breath in. So if I were to take a deep breath in, all of a sudden now, look at that. I've got that nice abdominal hollowing going on. That's not correct. That's just activating your diaphragm to kind of pull everything in. It creates a negative pressure. We want a contraction of the muscle, not just a negative hollowing of that abdominal cavity. And so the first thing that I tell people, the first thing that Camille's going to do is actually breathe out all of her air. So she's going to take a breath in and then breathe out all of her air. At the bottom of that exhalation, meaning she has no more air in her lungs, now what she's going to do is focus on contracting that deepest abdominal muscle, bringing her belly button right in towards her spine. She's going to hold that for about a 5-second count and then relax everything. Good. It's hard if you can. It's hard to hold your breath while you're doing the exercise, let's be honest. If you can breathe through it, that's great, but at least initially, as you're working on that abdominal contraction, I want you to breathe out all of your air. So again, deep breath in, deep breath all the way out, and then she's going to suck in her stomach, and then she's going to hold that for about a 5-second count, and then she's going to relax. And the progression here would be to hold for longer and longer, 5 seconds, 10 seconds, and on as you're able to breathe through it. And so that's your first do and don't exercise. Number two, the second don't that I hate for the diastasis recti condition is going to be a sit-up. And so sit-ups are just basically a, go ahead and hit it. Sit-ups are a more aggressive form of crunches. I'm going to hold your feet down.
Thank you.
Yeah. Just a more aggressive form of crunches. Again, we're working that rectus abdominis muscle even through a greater range of motion and against gravity. And so again, we don't want to activate that muscle resisted against gravity, what have you. And so instead, the do exercise that we're going to do instead is going to be a dying bug. Now, to get into a dying bug, what she's going to do is lift both of her feet up off of the ground. And so we're in a 90-90 position, 90 degrees here at the knees, 90 degrees here at the hips. She's also going to raise her arms straight up towards the ceiling. This is the starting position. From here, we're going to hit one of those abdominal hollowing maneuvers. And so I want you to activate that transverse abdominis. I want you to suck in your stomach in towards your spine as much as you can. Now we're going to hold that position while she's going to lift her left arm over her head and her right arm out straight, and then bring it back together. Take another breath if you need to, and then right back into the other side. Again, the most important thing that we can do here is activate that transverse abdominis muscle. I love this exercise because we're doing opposite limb, and then we're also kind of lengthening against gravity. Keep in mind here that we're not aggressively shortening, we're not aggressively activating that rectus abdominis muscle, but we're holding in, we're holding the transverse nice and tight, we're doing the suck it in muscle while we're working some of those other core layers as well. So there's exercise number 2. Awesome. And so number 3, the third exercise that I want you guys to avoid if you have the DR condition is going to be a plank. And so either a modified plank on your knees or a full plank all the way out onto your toes. Okay, so I like this exercise because we're not aggressively contracting that rectus abdominis muscle, but I don't like it because we are holding that static contraction. It is against a resistance, and there's basically a lot, and don't take this the wrong way, a lot of weight hanging on your abdomen. Basically all your guts, all your internal organs, you can go ahead and come down, all your internal organs are hanging down in this gravity dependent position. Again, the whole reason why you have that diastasis recti is because of stress that was placed on that ligament. And so for you to lay down like that, all of a sudden we're just putting more stress on that area. So again, you've got the weight of your guts hanging out on the internal abdominal wall, and now we're trying to contract against that. It's for those reasons that you should probably avoid planks, at least until that DR condition has been healed up. And so instead of a straight plank, what I'm going to do is roll Camille into a side plank position. And so now, oops, sorry, don't break the massage table. There we go. And so now in the side plank position, what I'm looking for here, she's on the outside of her left foot, on her left elbow. Her left elbow is directly under her left shoulder. I'm looking for a straight line, basically nose, belly button, between the knees, between the ankles. Should be a nice straight line all the way down. So now what we've done is and then the last thing that she needs to do is activate that TA muscle. So now she's going to suck everything in to activate that while we're holding this side plank. And so the thing I like about the side plank is that now we've rotated the weight of the guts off of that rectus abdominis muscle and we've shifted it over to the lateral abdominal wall. So she's holding that side plank position. The weight of the guts are on the lateral abdominal wall instead of the anterior abdominal wall. And then in that side plank position, she can also hit that TA activation, keep everything sucked in nice and tight. It's a lot easier to do that on your side versus down in that straight plank position against gravity. And so there they are, you guys. So those are the 3 exercises that I don't like if you have the DR, and the 3 exercises that I like. Camille loves them. They're like her favorite.
They are. I love them so much. But they work.
You've done a few of those. That's the thing.
Yes.
They're effective. They're super effective. So I hope you guys like this. I hope this helps you guys out. Hey, if it did help you out, go ahead and hit that thumbs up button down below. And thanks so much for those likes in advance. Also, if you haven't done so already, this is a great chance to subscribe to Tone and Tighten. I try to share a lot of great tips and advice, workouts, healthy recipes. My goal is to just help you guys to become fitter, healthier versions of yourself. I hope you subscribe to this channel. If you have any questions or comments about anything that we covered in this video, go ahead and leave that in a comment down below, and I'll get to that as soon as I can. And until next time, you guys, we'll see you right back here on Tone and Tighten.